Welcome, everybody. Thank you for joining us for this afternoon's webinar. My name is Jason Golden, and I'm the Marketing Director at Caton Direct. Today, we are presenting Beyond Analytics, What's Really Driving Candidate Behavior. It's my privilege to introduce our speaker and my colleague, Anthony Gentile. Anthony is a managing partner at Caton Direct. Anthony's been with Caton for 15 years and is deeply involved with business development and product development here at Caton. Anthony has watched healthcare recruiting evolve over time and helped guide Caton to be at the forefront of healthcare recruitment marketing. This afternoon's presentation will last approximately 30 minutes, at which point we'll turn to questions from attendees. We'll be focusing on understanding the touch points and interactions which most impact the candidate's journey from awareness to application. A recorded version of this webinar will be available and will be sent along via email along with the presentation deck after the webinar is complete. Thank you all once again. This promises to be a fantastic session. I would now like to hand off to Anthony, who will lead today's webinar focused on how to utilize multi-channel marketing to generate a steady stream of qualified candidates into your hiring funnel.
Great, thank you, Jason, and thank you all for joining me today to discuss Beyond the Analytics, what's really driving candidate behavior. I'm super excited by the turnout on this webinar. I see so many of our clients, recruiters and talent acquisition professionals and directors, as well as a lot of our agency partners, and certainly a warm welcome to all the new folks that have decided to join us today. So a little bit about me, for those of you who don't know me, I've been in the healthcare human capital space for the last 15 years, all 15 of those years with Caton Direct. Prior to that, I was with a company called Consensus Group, which is a negotiations and conflict management consultancy in New York City. I hold a bachelor's degree in psychology from Fordham University and a master's degree in industrial psychology from Columbia University. A little bit about Caton, for those of you who are not familiar with us. Caton has been around since 2003, servicing the healthcare industry exclusively. We help hundreds of healthcare institutions nationwide address their greatest hiring challenge, which of course is attracting experienced clinical talent. So needless to say, having spent the last 15 years with an exclusive focus on healthcare, we've amassed a ton of knowledge and best practices, which really allows us to speak authoritatively on topics such as this. So I sincerely hope that by the conclusion of this webinar, each and every one of you walk away with at least one important piece of information that will help you in your mission. So enough about Caton, and let's dive right in. And I think it's safe to say that the world and our culture in particular has really changed dramatically over the last 15 to 20 years, and we've become so much more reliant upon data to help us make decisions and solve problems. And I'm referring to the many forms of data, whether it be hard numbers like statistics or click rates and scoring models, or more anecdotal data like online reviews and approval ratings. With so many more options in front of us today than in the past, it became necessary to rely upon data to help us filter and score them so that it doesn't take us forever to make a decision. And all of this, by and large, is a good thing. And clearly in the marketing and advertising world, analytics have helped people gain insight into optimizing their ad spend. And this has been going on for quite some time. And as with everything else, talent acquisition is always a few years behind the consumer marketing world, and healthcare even a few more years behind that. But it has permeated into healthcare talent acquisition, and analytics have actually been around now for quite some time, helping recruiters and recruitment marketers gain insight into which sources deliver the best candidates. And this is also that talent acquisition can best determine the most efficient use of their budget, which, as we all know in healthcare, doesn't really seem to go up year over year. It most often goes down. And now what we're starting to see is supply chain becoming more intimately involved in purchasing decisions with HR and talent acquisition. And as we all know, supply chain really doesn't know much about what you're doing, and even less about the solutions and strategies you implement to get your job done. All they care about really is cost, and can you substantiate why you need those tools, which of course comes down in large part to metrics. So kind of coinciding with the evolution of analytics over time within the world of healthcare talent acquisition, the role of the recruiter has changed. In healthcare in particular, it's very clear why, and it makes a lot of sense. Top clinical talent has become increasingly more elusive, and every employer is in a constant battle with one another to hire the best clinicians. And with the cost of temporary staffing to fill the gap as high as it is, it made sense to reevaluate and develop a more strategic approach within the recruitment department. So the role of the recruiter, who operate on the front lines of this battle and can literally make or break the plan, has evolved from someone who reactively fills open recs to someone who is a strategic business partner and who understands the business goals, works hand in hand with hiring managers, and who understands the current and future talent gaps so that they can plan accordingly. So this is all great, but we live in the world of healthcare, and we all know that healthcare is different. It's a people business, which makes having the right people critical to the success of the organization. But what's concerning is that even with all the advancements in recruitment strategies and recruitment marketing technologies and insight via analytics that are supposed to help recruiters plan and make more strategic decisions, we still have a healthcare talent crisis. And healthcare employers are still spending exorbitant amounts on stopgap solutions. Consider this. Right now, average time to fill for an experienced nurse is 85 days. That's almost 3 months. And for physicians, it's around 240 days or 239 days, right? So if you think about this, that's almost, just for the nurse, that's almost 3 months. And if you think about what an average really is, it's a function of sometime being below that number, but also being above that number. So you could imagine that for those positions that require deep skill sets or expertise, that number is well above 85 days. Couple that with the average cost of $2,000 per day for a travel nurse, over and above the cost of the person. And this is the reason why we spent almost $13 billion last year in this country on travelers, on locums, on some form of temporary supplemental staffing in healthcare. In terms of demand, 10,000 Americans are turning 65 every single day. Not every year, not every month, not even every week. Every single day, 10,000 Americans turn 65. 66% of Americans have at least one chronic disease, and 20% of Americans age 65 and over average 40 medical visits per year. So what's the common thread? What does this all mean? And more importantly, what does it mean for healthcare talent acquisition? Because it's obvious that the talent crisis has spun out of control, and the cost of band-aid solutions like temporary staffing is pushing healthcare organizations to their breaking point. And unfortunately, I hate to say it, there really is no hope in sight and no light at the end of the tunnel. If you think you see light at the end of the tunnel, I can assure you it's not the end of the tunnel. It's the light from the train in the opposite direction, racing towards you as it relates to demand for services. And personally, what I've witnessed, especially with the advent of recruitment marketing, is that the influx of data and metrics and analytics, which is supposed to really be aiding the problem and contributing to the solution, in some instances may actually be making the problem worse, as HR and talent acquisition either misinterpret the data or overanalyze the numbers or errantly ignore the entirety of the candidate journey in favor of just one part of it. More on that in just a bit. And before we go any further, let's make sure we kind of take a step back and agree on, kind of what the bright future looks like. What is the light at the end of the tunnel? Where are we all trying to get to? For physician recruiters and nursing recruiters and all healthcare recruiters and directors at TA, it's about, a strategy and a place where attracting top talent became easier, right? A place where, candidates can find you as easily as you find them. A place where you can source easier. I know for a lot of recruiters, sourcing has become increasingly a bigger part of their job. And, if you're a recruiter and you have a full rec load and you're kind of bogged down in administrative tasks as it is, sourcing is not the easiest thing to bring on board, but imagine if sourcing became easier. If you could rapidly grow your talent community, and I mean grow your talent community with the type of high value candidates that'll help reduce that time to fill and ultimately allow you to hire the best candidates. Because at the end of the day, this is about patient care, and better talent provides better patient care. I don't need to cite any metrics or charts or graphs to show you anything. It's as simple as that. Better talent yields better patient care. So let's talk a little bit about attribution and attribution modeling. In other words, who gets the credit? So many of you are familiar with attribution and attribution modeling. Attribution is essentially accounting for applicants and hires. It's the tell us how you heard about us drop down on the application or talent community form. Where did these candidates come from? What was our ROI? And how do we want to leverage this data so that we can make smarter decisions in the future and optimize budget? But this type of attribution is rife with flaws. For starters, many candidates don't really report this accurately because they're in a rush, or they don't remember, or maybe they don't care, or they could actively be trying to misinterpret it for whatever reason. Second, it's oftentimes not an exhaustive list. candidates can hear about you or your organization or your job from so many different areas, and you possibly can't list all of them. So what do? You include an other section in there. And most people, myself being one of them, I just want to get to what I want to get to, and I just probably would check off something as opposed to type in what the other is. And candidates do that all the time. And finally, it kind of represents an all or none scenario for the candidate who oftentimes can't select multiple options. If candidates heard about this opportunity through multiple sources, they're oftentimes forced to select just one, which gives all the credit to one source and denies it to all the others. So even though self-reported attribution is designed to give recruiters insight into which sources are driving the best candidates and which are producing the best return, there are obvious flaws that we just discussed. So one way to improve upon this is with technology that removes the self-reporting human error. And this is where attribution modeling comes into play. So what is an attribution model? An attribution model is the rule or set of rules that determine how credit for conversions is assigned to touch points in the conversion path, otherwise known as the candidate journey. And there are many models of attribution, ranging from the very simple to the very complex. And the very complex attribution models tend to be the most accurate and provide the best indicators of performance, but they're not really widely used by anyone other than very large organizations with sophisticated marketing teams. So most organizations that want to report on attribution use simpler models that are more basic and easier to implement. But the problem is they provide the least amount of opportunity to gain new information and optimize campaigns. Why? Because they're looking at a very limited portion of the journey. They're not really telling the whole story. So I'll give you a very simple example here. For those of you who golf or familiar with golf, you understand that the concept is to get the ball in the hole with the fewest amount of strokes. So if you saw two scorecards and two golfers and they both got a 3 on the last hole, you'd assume that these are similarly skilled golfers who took the same kind of path towards getting that 3. But if you actually watched each of them play and you saw the different touch points along the path, and you saw that golfer A kind of teed it off perfectly right in the middle of the fairway, beautiful second shot, chipped it right up to within a foot of the hole and sunk the 1-foot putt with ease. Then you saw that golfer B teed off and hooked it into the woods, and it was going to go way over the fence and out of bounds, but luckily it hit off of a tree and popped back out into the fairway. And second shot, they smashed it, and it was going to go way over the hole and into a lake, but lo and behold, it actually hit the flag and dropped within a foot of the cup, and they sunk the putt for a 3. So if you really look at the journey that both of them got there, you'd actually see where one of them needs improvement, and you could see how you could optimize that person's game over time. It's the same thing with attribution modeling. If you just look at the first click or the last click, it's not going to tell you the story in between, so you don't know where to optimize. So that's, and again, those kind of multi-touch attribution models are really more designed for sophisticated marketers at larger organizations. So again, most organizations focus on simple attribution models like this one. This is called first touch attribution model, meaning what was the first measurable click along the journey? Conversely, the other simple attribution model is the last touch model. And this model almost ignores everything up to the point of application, and it says, okay, source equals Google, then Google gets all the credit. And looking at this in terms of the recruitment marketing funnel, which given the increase in popularity of recruitment marketing over the last few years, you've probably all seen this ad nauseum, but it really does illustrate the point. You have the whole high value talent pool on the top, the 3 million plus nurses in the US, the 1 million plus docs in the US, or whatever your talent pool you're going after and whatever regional or local market happens to be. These are the candidates that are not part of your talent community, and there is not a relationship established between you and the candidate. And the whole point of looking at it this way and of implementing a recruitment marketing strategy in the first place is to create an ongoing initiative that is attracting candidates from the disconnected talent pool into the upper stages of the funnel, cultivating and nurturing candidates that are in the middle stages, and creating a timely, optimal experience in the bottom stages of the funnel to convert that high value relationship into a qualified applicant. So you see here, this is where the first touch exists of driving the candidates into the funnel and building the relationship. Then you see the last touch at the bottom, which is the final jumping off point where the candidate decides to push all their chips into the middle of the table. But let me point out several problems that are going on here, 2 of which are clearly obvious, and the last one might be a little bit eye-opening. So first touch attribution does not measure what happens after the initial relationship is built. So it's hard to gain insight into the other factors that contributed along the way to the application. And last touch attribution does not really factor in the antecedent behaviors that led to the application. And in both of these models, what if those interactions that you see that you're not focusing on are really important? And more than that, what if they're critical to the conversion? What if you've decided to abandon them entirely because you didn't have a clear-cut way to measure them? It's a really scary thought. And this is the least obvious problem, but perhaps the most important, and it serves as a great segue into our next point. We know that in healthcare, 92% of the high-value talent pool is passive. That's an incredibly high number, and a main reason why healthcare is so much more challenging than any other industry. Most healthcare recruiters and talent acquisition professionals are not actively targeting this pool, and if they are, they're probably not doing it consistently or comprehensively. Chances are they're still relying on what I call catcher's mitt strategies that simply lie in wait for the candidate to make a move. That's a recipe for disaster, and organizations that start to realize that or have realized that and implement a more proactive ongoing strategy to tap into this audience are going to win the war for talent. Finally, we know that 80% of the candidates that reside somewhere in the funnel are in the middle. That's an overwhelming majority. So having an attribution model that don't consider the middle, or if you don't have a strong communication plan to nurture these candidates in the middle, you're missing out in a huge way, because that's where most of the talented candidates are and where your best chance of conversion lies. And keep in mind that retargeting ads or simply sending out an automated email is not a very strong candidate nurturing strategy. So let's talk a little bit about the recency effect, the story before and in between the clicks. And what is the recency effect? Well, in short, it's the principle of learning that states that the most recently learned states that things that are most recently learned are best remembered. And I think the key word in that definition is learned, because that's essentially what marketers and recruitment marketers are trying to do. They're trying to teach people and to condition them in such a way as to bias their opinion in favor of them. And bias, which typically has a negative connotation, but certainly does not in this context, is exactly what you're trying to do. I don't care if you're trying to recruit experienced nurses or doctors or any in-demand medical professionals. The idea is to create positive perception so that you shape opinions favorably in your direction. This way, when the candidate decides to make a move, they're much more likely to consider your organization or even seek you out. So let's take a quick peek back to the recruitment marketing funnel, because I think it'll help illustrate the point here. There's two main areas that we've identified where help is needed. The first area is attracting the best candidates into the funnel. And again, I'm not referring to the catcher's mitt approach we talked about earlier, which is to lie in wait for a great candidate to find you. It's not going to happen. Job seekers will find you. Great candidates won't, because they're not looking. So a high-touch, outbound, ongoing initiative that's kind of all neatly bubble wrapped in a personalized candidate experience is your best bet for inspiring the most experienced clinicians to begin the candidate journey with you. And the other area is the middle of the funnel. You know, you've established the beginnings of the relationship with a great candidate, and the candidate is starting the journey, but the goal was to get them to complete the journey and make sure they complete the journey with you and not one of your competitors. So an ongoing communication plan that's personalized and engaging and relevant is ultimately going to lead to success. I'll give you a very, very close to home example. One of the best demonstrations of using the recency principle to sway opinion is actually the marketing departments from healthcare organizations who are always actively recruiting patients. So Memorial Sloan Kettering Cancer Center is an organization that most people are familiar with, and even if only at a cursory level. And by and large, when you hear that name or see that logo, it paints a very positive picture in your mind. Words like excellence and prestige and world-class and professional automatically just pop into your head. And much of that is a function of the results they deliver and the statistics on patient care outcomes. So given all of that, you'd think that their reputation just speaks for itself. Why would they need to spend money reinforcing their brand or creating awareness? But you know what you can't miss? Even if you tried, you cannot miss seeing the ad as you walk to the subway, or waiting to hop on the crosstown bus, or simply taking a stroll down the street and looking up. or seeing their videos online while you watch an ad on YouTube and wait for your content. So all of these exist as touch points along the way that are a constant reminder to people, the overwhelming majority of whom do not need to consider using their services at that particular moment. So what's the ROI here? And how do hospital marketers measure the success of these campaigns individually? Do they know how each of these campaigns is individually contributing to the uptick in patient recruitment and therefore revenue? The answer is they don't. And this is a perfect example of where analytics and metrics and conversion rates basically get thrown out the window because it can't be measured. They're leveraging the recency effect and basic human learning principles in order to favorably bias consumer behavior. Just think about what Memorial Sloan has done here. They've actually educated and biased the opinion of a huge population of people to be conditioned to think that if ever someone finds themselves in the unfortunate position where they find out they have cancer or a loved one has cancer, that Memorial Sloan is the place to go. There's no need to Google it, ask around, or do any research. People just inherently know. In other words, we've already made the decision to go to Memorial Sloan before the decision needed to be made. That is an incredibly powerful position to be in. So what does this all mean? And more importantly, what does it all mean for healthcare talent acquisition? So in the previous example of Memorial Sloan, it really highlights a major difference in the approach that healthcare marketers take to influence patients and healthcare recruiters take to influence talent. Because most people, when presented with the terrible news of cancer or a loved one that has cancer, they already know the answer to the question of who provides the best cancer treatment. Memorial Sloan Kettering does. On the flip side, when a healthcare professional, be it a physician, a nurse, or any practitioner for that matter, thinks to themselves, I need a new job, what do I do? What employer you think pops into their head? The answer is probably none of them. And it's most likely Google, or it's a job board, which is pretty much the same thing as Google, or they seek the advice of a friend. As a recruiter, this kind of places you a little bit in a pickle, right? Because you think to yourself, is my job and my organization, are we going to show up in that search? If it does, will it stand out or be impactful? What will other people tell this person about my organization? Will it be positive? Will they push them in a different direction? As you start to think about this more and more, you see that it's a much weaker position to be in than the healthcare marketer that has taken the recency approach, among many other things that they're doing, obviously, to positively bias the opinion in advance of the decision. So let's talk a little bit here about goals and drivers. If you think about what the question really is that most recruiters ask themselves every day, it's how do I best use my resources to convert more high-value candidates into applicants, which is the best case scenario, or drive the ones that are not ready to apply either into my talent community or schedule a conversation, next best case scenario. In order to do that, recruiters select a mix of tactics or drivers to these goals, social media, career fairs, programmatic, among them. Then they deploy, measure, and compare against the cost and ultimately determine value. But there's two problems going on here. Problem number one is that it's too siloed. It's only looking at the drivers individually and saying, well, what was this tactic we used? How much did it cost us? And what was the return? It's not really considerate of the idea that the drivers or tactics are playing in harmony with one another and may in fact be supporting each other more than leading to the conversions themselves. The second problem going on here is that recruiters tend to focus way too much on vanity metrics, click rates, and open rates, social media likes, and site visits. These are all examples of vanity metrics that don't really mean anything because they aren't telling the story of success and they can really steer you off course. Judging based on vanity metrics can cause recruiters to make snap decisions, such as over-investing in tactics that aren't really producing results, or worse, abandoning a tactic that is producing actionable results simply because you're not measuring it the right way. So what can you do? I think a good way to look at how the goals and drivers and results all kind of work together is to think of them more holistically. This helps to account for some of the last click attribution bias, which obviously favors Google in a huge way. Email blasts and retargeting and social media are often generating Google traffic, which is on your end what you see. It's interesting, even Google recognizes this, and interestingly enough, they're working to combat this problem for marketers and recruitment marketers to help them learn the story before the click, assign value to those touch points, and actually ultimately share the credit. Go figure. They're actually building a multi-touch attribution model that takes credit away from them and shows you where it's happening along the way. Figure that one. Also, you want to think about focusing more on actionable metrics than vanity metrics. Actionable metrics give you a much better sense of talent acquisition success, because success is not open rates or click rates or social media likes. Success is high value applicants that translate into great hires. In other words, if an email blast is producing open rates or click rates that you feel may be subpar, you need to understand what else is in play here. Are email recipients who don't convert through that link more likely to attend your next career fair, or do a Google search for your career site, or notice your job first on a job board regardless of where it's positioned? This is what's known as the lift effect, which means that the impact of a particular tactic might be indirect as opposed to direct, as in the case of a candidate who constantly receives your email marketing, never responds to that email, yet shows up at your next career fair. And one way to do a lift effect analysis is to change messaging around, or do an A/B test against a control group to see if a different message is having an impact on results. And that kind of brings me to my final point, which is to shift some of your focus away from the drivers, or tactics, or delivery methods so that you can concentrate more heavily on improving the messaging, because it's ultimately the message that resonates. Some tactics are better than others, and constant communication with your core talent pool to stay top of mind is vital. But what you say is often more important than how you say it. So some final thoughts before questions, and I see that there are a bunch. As you move into planning phase for 2019, which I know for sure many of you have already started or even close to being finished, ask yourself if you've allocated enough budget to telling the story before and in between the clicks. If you're unsure, not certain, or just want to verify if you've devoted enough resources to this, let us know. Caton can help. So here's all my contact information. I'm going to turn this back over to Jason, who will probably get through a few questions before we pop off for the day. But again, here's all my contact information. Most of you know me anyway, so feel free to reach out if you have any questions. Jason?
Great. Thank you very much, Anthony. That was fantastic. We're going to go ahead and take some questions now. Just a reminder to our attendees to type your questions into the question box in the control panel. And we've got a few that we're going to go ahead and ask Anthony. First one, I'm a nurse recruiter and I see my hospital marketing department is doing, and I love what they're doing, but my budget is limited. Is it possible that I can do something similar given my budget constraints?
Good question. I certainly recognize that the marketing department has significantly more resources in terms of dollars and people to run an ongoing awareness campaign, and it would never really make sense to place a recruitment ad for nurses on a billboard or the crosstown bus. You need to be more targeted than that, because the entire population is not your audience. Nurses are your audience. So the larger you can grow your talent community, mainly by proactively targeting nurses into your talent pool, the better. This way you'll have a huge audience of the right people, and that's who you base your ongoing nurturing campaign off of.
Great, thank you. Next question is from a physician recruiter working at a large healthcare system, operating on an island as a one-man band. What we presented today sounds really great, but they're not sure where to start.
Okay, so I hear this a lot from physician recruiters, so you're not alone. It's interesting. You think that a job category like physicians that carries so much revenue potential with it would have more resources attached to it to make the task of attracting and hiring top docs a bit easier, but unfortunately, that's most often not the case. First thing you should do to get started is to get buy-in from leadership, but it's always better to approach leadership with possible solutions as opposed to just problems. I find that to be more effective. And there's actually databases available along with technology to help you manage the data. So I'll connect with you afterwards and send you some information on some options that you might have.
Great, thank you. Next question is, you spoke about vanity metrics that we should not focus on. If we shouldn't focus on those, what metrics should be important?
That's a really great question too. I think the reason why most people rely on vanity metrics because that's all they know, or they're simply not aware that these numbers are less important than actionable metrics. For example, if you see that you're receiving a lot of applications from a particular source, it might seem like a great cost per application, but if the applicants are all very low quality or not relevant at all, then what's the point? It doesn't matter how many applications you receive if none of them turn into quality hires. So look more at the actionable metrics like conversion rates for high value candidates or followers that could potentially turn into great hires.
Fantastic. Thank you. It looks like a majority of the remaining questions are about our services and how we can help. Instead of going over those, Anthony will follow up individually. I want to thank everyone for joining us today, and look for an email in the coming days with a link to the webinar recording and presentation for you to download. Thank you all again, and have a wonderful rest of your afternoon. Thank you.